Oh, action. Hi, good morning. It's Miss Fame getting ready to do some Fraxel resurfacing, and my main focus for this was I've been wearing a lot of makeup and I'm a bit textured and my pores are a bit large. It's because I have oily skin. I have thick skin. So this is going to be a nice intensive treatment to get on top of it, and this is what I would recommend to do in the fall, winter, because you can bounce back. I know it takes about 7 days. I've done this before, but this is a great way to kind of show the process of what it's going to take. First off, we're doing a numbing cream. It'll be on for how long?
40 minutes.
And then it will be a lot easier to get a really deep Fraxel, get my skin sorted out for my working year. Excited to show it with you, or share it with you. All right, so now I've got my numbing cream on, and I'm going to be focusing on the entire face. Obviously, that's my main focus. Because I had acne-prone skin when I was a teenager, preteen, well, you know, I ended up having a lot of texture in my adult life, and I still break out. Like I have got a nice pimple inside the hairline, on the side of the eye. I have a few underneath the neck, of course in the middle of the cheek, and then I end up getting congestion, which causes bumps. So a lot of the time people don't see it because I'm wearing makeup and it's properly photographed and lit or retouched, so you end up not seeing those things. But on a closer inspection, you'll be able to notice that over time I do have a bit more of a darker pigmentation here. This could be sun damage, it could also be a bit of melasma, but the main focus for me is just getting my skin texture under control. And I never neglect the neck, so when I do this service or any type of skin service, I usually carry that through the neck. My neck skin is like the gold skin, it's beautiful, but I don't want to focus on one area and neglect this area, because as I'm aging, I want to make sure that I stay young and beautiful throughout the whole neck and face, because that's also very important through maintaining youth and maintaining healthy and beautiful skin. We're filming now.
We're filming now. Okay.
I'm introducing the incredible Dr. P. Frank, and we're going to be doing Fraxel today.
We're doing Fraxel for a few purposes. Aside from just general anti-aging purposes, you do have a history of acne.
Yes.
And some textural abnormalities here. So we're using what's called the Fraxel Dual. There are two types of Fraxels in this device. The first one is called the Restore. That's really going to go deeper. It's going to work texturally on your skin. It's going to help with acne scars and really just make it very silky smooth and helps with preventive for fine lines. The other Fraxel is the Fraxel Thulium. That's the Windex of the skin. Brown spots, sun damage, pores, superficial texture. So by using the two together, it's like playing a fine instrument. We cater it to the person, and for you, we do a little bit of everything to give you the best result.
Perfect. I will make a note. My main acne was like centralized. I have more texture here.
Okay.
I have some kind of discoloration here. I have a birthmark up there, which is good to go. And then my darker patches up here in the summer, this shows up, even with SPF. And I do wear SPF. I do everything in my power to keep my skin together, but I know that this is like the next step, and it's winter, fall, winter.
Yeah.
So it's a good moment for us to get into this step of the skin.
Yeah. You have
so
to,
we can improve on the pore size and the acne scars.
You have to look at the skin almost like a road that needs repaving every once in a while.
Yeah.
Everyone's different based on your skin color, whether you have acne, how you're aging. What's unique about this technology is we can play the instrument in a certain way that kind of addresses everybody. There's no one above the age of 25 that can't benefit from a little repaving of the road.
I love that.
All right.
I can't wait.
Okay.
I love Fraxel. All right, here we go.
All right, let's cover it up. We're turning to the side. You're still in frame. There we go.
I feel nothing. It's really not an issue at all.
Really?
Right away, yeah. But I had numbing cream on, so it's probably helping.
Yeah. I mean, some people like to take a pain reliever, but you're pretty tough.
Yeah, I'm committed to making things better.
Yeah. And this is the deeper of the two, so this is the one that people usually feel. Again, the Fraxel Restore, this is better for deeper textural tightening, mostly acne scar type things.
Incredible.
Both lasers within the Fraxel Dual are what are called non-ablative. Okay. So the recovery, there's no open skin whatsoever. You'll really just look like a slightly swollen Cabbage Patch Kid type of thing. You'll look a little red and puffy.
Cool.
That's really it. Some people like the puffiness. But it's, I mean, people put on makeup after this treatment. It's just for about 4 days. You're not going on any first dates or weddings, so to speak.
Oh, well, I'm married, so I think I'll be okay.
There you go. There you go.
How many passes do you like to do?
I'm probably doing about 8 passes.
Okay.
6 to 8. I'm going to be, again, using the other Fraxel on top of this. I like to get the deeper one over with just for, you know, getting the painful part over with. I don't treat every area of the face the same. Every area is going to be a little different based on what I see. You know, Fraxel is not Fraxel. It's really how it's done that's going to make all the difference.
Right.
And I tell people, it's like an instrument. You have to play it to the audience.
It's fine tuning.
It's fine tuning.
Yeah. So I'm on day 2 of healing from my Fraxel treatment I had at Dr. Paul Frank's office yesterday morning. And my skin is very dry and very red. All right, so here's my face. Day 3 post Fraxel laser. Now, what you're seeing is moisturized skin and it's very dry. It's like a sunburn and all of it's flaking off and you're seeing red new skin underneath, which will settle down in the next days. All right, day 4 post Fraxel laser, and my skin has started peeling last night actually in the shower. Very, very red, but I know that it'll calm down. I'm just keeping it very moisturized and staying out of the sun completely just to get through these most intensive days. All right, so I'm at day 5 from my healing journey from Fraxel laser. I have no makeup on, I just have moisturizer. I did break out on my left side. I just think the skin is kind of going through a little bit of accelerated turnover, and I'm very pink on the right side still, but at least we've got most of the dryness off. I'm just going to moisturize continuously. Day 6 post Fraxel laser, no makeup. All right, so I'm going to do a little quick magic with Miss Fame under my skin palette. I've already put it down a base on my skin, a little face and body foundation, and etched out my eyebrow. So I'm gonna build the shape